This is Doug Brunk reporting from a psychopharmacology conference sponsored by the Nevada Psychiatric Association in Las Vegas. Brain amyloid deposits can now be visualized by a new PET scan technology, a tool that is currently being reviewed by the FDA.
Yes, this is a really powerful new technological discovery that I think is going to reform the way we think about the diagnosis of Alzheimer's disease. Alzheimer's disease is almost, not quite, but almost the only disease that causes increased amyloid in the brain in the elderly. And we now have a PET scan which uses ligands that were originally used to label the plaques at autopsy. And it was realized that you could label these with positron-emitting substances so that you could then map the presence of amyloid in the brain. So now we can make a competent diagnosis of Alzheimer's disease in a dementia patient. More importantly, we can make a diagnosis in the patient who has mild cognitive impairment. Some of those patients have Alzheimer's disease, some do not. And the new amyloid PET scans will help us know which of the MCI patients have Alzheimer's disease, and therefore we would start them on possibly considering therapies, getting them into clinical trials, working with those families differently than someone who's not on the Alzheimer's disease trajectory. This scan, the AV45 scan, is currently under review by the FDA. We don't know exactly the time schedule for approval, but I expect that within this year, 2012, we will have AV45 available for scanning in any institution that has a PET scan. Yes, I think it's important that we don't think of Alzheimer's disease care as writing a prescription. That what we're trying to do is to show how much life there is left in the Alzheimer patient. It's not about what they have lost. It's about maximally utilizing what they still have left. And I think that's achieved by working with caregivers to make sure that they are prepared for this disease and educated about this disease and know what they can do to help. It's about talking with patients, and of course we use drugs, we use cognitive enhancers for them, but we also talk with them about diet, we talk with them about exercise, we talk with them about social and mental engagement. These are the things that I see as part of a comprehensive, integrated care package that make a real difference in the quality of life of our patients.